Regular supplementation with resveratrol improves bone mineral density in postmenopausal women is a randomized placebo-controlled trial by Wang et al. 2020 and addresses significant gaps in understanding the potential bone protective effects of resveratrol in postmenopausal women, a demographic particularly vulnerable to osteoporosis due to estrogen deficiency. Osteoporosis is characterized by progressive bone tissue deterioration, leading to an increased risk of fractures, particularly in the lumbar spine and femoral neck. This condition results from a reduction in estrogen, which normally suppresses osteoclast activity and promotes its apoptosis. Without estrogen, there is an accelerated trabecular bone loss due to an increased osteoclast activity, leading to a decrease of 12% in bone mass within 5 to 7 years after menopause. The rationale for Wang et al. Was to address the critical health challenge of osteoporosis in a postmenopausal woman cohort, focusing on this rapid loss of trabecular bone mass, which significantly increases fracture risk. Consequently, there was a need for effective interventions that might mitigate bone loss and enhance bone strength in this population. Resveratrol, a naturally occurring still-bean polyphenol found in red grapes and berries, has emerged as a promising candidate due to its phytoestrogenic properties, allowing it to bind to estrogen receptors and potentially replicate some of estrogen's protective effects on bone. Another critical aspect of Wang et al. Was exploring microvascular dysfunction as a contributory factor to osteoporosis. Aging and chronic conditions can impair blood supply to bones, exacerbating bone loss by promoting hypoxia, upregulating osteoclast activity, and inhibiting osteoblast function. Given resveratrol's established cardiovascular benefits, including improved endothelial function and vasodilation, the study posited that resveratrol could enhance bone health through osteogenic effects and by improving bone perfusion and microvascular health, and thus aimed to offer a dual therapeutic approach addressing both structural and vascular components of bone health in postmenopausal women. Additionally, Wang et al. Aimed to determine resveratrol's effects on bone health by concurrent intake of vitamin D and calcium, supplements given they are commonly consumed by older adults to support bone health. In vitro and in vivo studies, particularly with TOE 2015, that examined overrectomized rodent models mimicking postmenopausal osteoporosis, have shown that resveratrol can promote osteoblast activity while inhibiting osteoclast-mediated bone resorption. However, clinical evidence supporting these effects in human populations has been limited and inconclusive, primarily due to the short duration of past studies and the lack of trials specifically targeting postmenopausal women. This reasoning was what led Wang et al. Being approved by the University of Newcastle's Human Research Ethics Committee to undergo the trial called RESURE. The RESURE trial took place as a 24-month randomized, double-blind, placebo-controlled, 2-period crossover intervention and was designed to rigorously evaluate the potential bone protective effects of resveratrol in postmenopausal women. Aiming for a cohort size of 170, RESURE was divided into 2 groups of 73 to then take capsules of identical shape and color containing either 75 milligrams of transrevetrol or a placebo mixture of insert excipients over a period of 12 months while keeping their regular diets. RESURE demonstrated that resveratrol supplementation significantly improved bone mineral density at critical skeletal sites in postmenopausal women, with a notable compliance rate of 96% amongst both groups. After 12 months of taking 75 milligrams resveratrol supplementation, the participants in the resveratrol group showed a notable increase in BMD at the lumbar spine from 1.069 cm squared to 1.085 cm squared, and at the femur and total hip compared to those receiving placebo. The lumbar spine BMD improvement was statistically significant with a p-value of less than 0.001, highlighting a significant impact of resveratrol on bone density. The increase in BMD at the femoral neck and total hip resulted in an improvement in BMD to 0.875 centimeters squared and 0.911 centimeters squared, translating into a reduced 10-year probability of major osteoporotic fractures, including hip fractures. These findings are moderately significant with p-values of 0.035 and 0.029 respectively. And given the high morbidity associated with fractures at these sites in postmenopausal women, this value is critical. Importantly, the bone protective effects of resveratrol were most pronounced in participants with lower baseline BMD, indicating that individuals with poorer initial bone health benefited more from the intervention. Resveratrol supplementation was also associated with a 7.24% reduction in C-terminal telepeptide type 1 collagen levels, a biomarker of bone resorption compared to placebo. This finding suggests that resveratrol not only promotes bone formation, but also inhibits bone resorption, critical for maintaining bone strength and reducing the risk of fractures. The reduction in bone resorption indicates a suppression of osteoclast activity, aligning with the hematology explanation by Wang et al. Posited in the introduction. Further subgroup analysis indicated that participants supplementing with both vitamin D and calcium experienced specific changes in bone mineral density that suggest potential synergistic effects. For instance, the group receiving both supplements showed a notable increase in lumbar spine BMD compared to the group without supplementation, indicating enhanced bone density. Additionally, this group had lower levels of bone turnover markers such as CTX compared to the vitamin D only group, pointing to a potential reduction in bone resorption. These findings suggest that the combination of vitamin D and calcium could be more effective in promoting bone health than either supplement alone, highlighting the value of using multiple interventions to optimize bone density outcomes. In 2020, the RESURE study was the longest known clinical trial on resveratrol supplementation in postmenopausal women, highlighting some promising results but also raising critical points for consideration. While a 12-month regimen of 75 milligrams twice daily showed positive effects on bone density in the lumbar spine and femoral neck, including a reduction in the bone resorption markers CTX, these findings must be interpreted with caution. The observed benefits of bone mineral density and fracture risk at key sites like the femoral neck are noteworthy, but previous studies using higher doses, for example 500 milligrams, the observed benefits of bone mineral density and fracture risk at key sites like the femoral neck are noteworthy, but previous studies using higher doses, such as 500 milligrams per day, did not yield consistent improvements at these critical sites. Furthermore, the correlation between improvements in bone density and vascular responsiveness may suggest additional benefits, but this relationship needs further exploration. Additionally, the required dose of 75 milligrams is far above typical dietary intake, such as the 0.933 milligrams per day observed in Samora Ross et al. 2008, implying that practical resveratrol benefits necessitate supplementation. Therefore, while the findings are promising, more research is needed to clarify the efficacy, optimal dosing, and long-term safety of resveratrol for bone health in diverse populations. The study suggests potential synergies between resveratrol and supplements like vitamin D and calcium in enhancing bone mineral density, but significant limitations affect these findings. The small sample sizes within the vitamin D and calcium subgroups raise concerns about the study's statistical power and generalizability. Additionally, the lack of data on participants' serum 25-hydroxyvitamin D levels and dietary calcium intake limits the ability to draw definitive conclusions about the interactions. While the 12-month crossover design aimed to control for seasonal variations in vitamin D status, this does not fully address the confounding variables. The study also relies heavily on hypothesized mechanisms such as enhanced vitamin D receptor expression and increased resveratrol bioavailability, without direct evidence. To validate these potential benefits, larger and more controlled studies are needed to establish clearer clinical guidelines for combining resveratrol with other supplements in managing osteoporosis. Wang et al. Compared resveratrol to genistein, another phytoestrogen with established benefits for bone health in postmenopausal women. A clinical trial with 389 osteopenic postmenopausal women reported significant increases in BMD at the femoral neck and lumbar spine, following 56 mg per day of genistein supplementation over 12 months, with further improvements observed in the second year. In contrast, the resource study's older participants showed smaller increases in BMD at these sites, which could be attributed to their better baseline bone health and fewer adverse effects with resveratrol use. These outcomes support resveratrol's potential as a therapeutic agent for mitigating bone loss in this population. However, there are critical areas where future research could expand our understanding and improve clinical application of resveratrol in bone health. One significant knowledge gap identified is the precise mechanism by which resveratrol influences bone metabolism. The study suggests that resveratrol's bone protective effects may be linked to enhanced microvascular perfusion, which is critical for bone remodeling and the maintenance of bone integrity. Future research should explore the molecular pathways involved, specifically focusing on resveratrol's interaction with estrogen receptors on endothelial cells and its subsequent effects on bone reperfusion. These pathways are essential in confirming the link between vascular health and bone metabolism and could allow microvascular dysfunction treatments as an approach to osteoporosis. Another area for future exploration is the long-term safety and efficacy of resveratrol supplementation. While the study provided evidence on positive effects over a 24-month period, the long-term implications of chronic resveratrol intake on bone health and overall well-being remain unclear. Extended follow-up studies are necessary to determine whether the observed benefits are sustained over time and to monitor any potential long-term risks, particularly concerning the dosage used. Further, expanding the research to include diverse populations is critical. The current study focused on postmenopausal women, a group at high risk for osteoporosis. However, resveratrol's effects on other demographics, including men, younger women, and individuals with varying levels of baseline bone health, remain underexplored. Comparative studies across these groups could provide a broader understanding of resveratrol's efficacy and identify any population-specific responses or benefits. Lastly, integrating advanced imaging and biomarker analysis in future studies could provide deeper insights into the microstructural changes in bone tissue associated with resveratrol supplementation. Techniques such as high-resolution peripheral quantitated computed tomography could offer more evaluations of bone quality beyond BMD measurements, including assessments of bone strength and microarchitecture. Moreover, exploring biomarkers of bone turnover in conjunction with these imaging modalities could help delineate the temporal dynamics of bone formation and resorption processes influenced by resveratrol. Wang et al. Makes a compelling case for resveratrol as a promising agent for improving bone health in postmenopausal women. However, a comprehensive understanding of its mechanisms, optimal use in combination therapies, long-term safety, effects across diverse populations, and detailed impacts on bone microarchitecture are critical areas for future research. Addressing these gaps will not only enhance the clinical utility of resveratrol, but also contribute to broader strategies for osteoporosis prevention and treatment.